Topic today, acne scarring. How do we treat it?
Well, first we have to treat the acne.
Good.
Make sure it's cleared up with proper products and hydrofacials, and then we deal with the scarring.
This is really a vexing issue. We have patients who come to us who have struggled with this for 5, 10, 15, 20 years.
Yeah.
So in patients who have chronic acne scarring, what are your options?
SkinPen, microneedling is safe, effective, and any skin type across the board.
With the scarring, which has left divots and contour deformities, what are the best way to volumetrically replenish these areas?
Adding exosomes, PDGF, or PRP.
What if patients come to you and they have tried this and they've tried other modalities and they have gotten no appreciable improvement? What are your options?
Well, consistency. It's always consistency. It's, it's not just a one and done.
Okay.
It's maybe 3 or 4, honestly, and maybe intervals of something like a medium depth peel.
Okay. We talk about the aesthetic ladder.
Yes.
So what would you call the bottom rung of treatments?
Just basic microneedling.
Okay.
Mm-hmm.
So
or maybe hydrofacial.
Using something to try and stimulate collagen induction with microneedling, or we call minimally invasive percutaneous collagen induction. So when you're looking for an option to really get access to that reticular dermis, you need a way to put the key in the door and open it. We love using SkinPen. Right here, boom. This is the go-to for us in our practice for getting access to that skin, microneedling through that dermis tissue to get access to the reticular dermis. So if you have somebody who has acne scarring, what's your go-to?
PRP, platelet-rich plasma. Fantastic.
I love it. And so we draw their blood, we spin it down, and
put
we
it in a
isolate
centrifuge. Yeah.
The platelets have in there the amazing regenerative ability of all of the granules. And when they get degranulated, they release all their cytokines and all their growth factors. And by microneedling through that tissue using SkinPen, we're able to unlock that and deliver all these growth factors right into the tissue.
It opens a channel to go deeper into the skin.
What do we do in individuals if we are looking at the aesthetic ladder? And as an esthetician, you get to be first line. These patients are frequently coming in and seeing you and saying, hey, Shannon, this is something I'm struggling with. What are my options? So give me the first 5 options that you talk to them about.
Microneedling, medium depth peels, consistency, skincare products at home, and lasers.
So these are what we call the introductory treatment options. Very frequently, since we are a combination of esthetician, nurses, PAs, and plastic surgeons, we have the full spectrum of the aesthetic ladder. We just had a lovely patient the other day who had tried multiple things. She had suffered for 15 years with her acne scarring, and she really felt that she had some improvement, but it wasn't delivering the results that she was looking for.
Right.
So she came and we talked, but since I live at the top of the aesthetic ladder, I recommended she consider fat grafting and then combination nanofat. And she came in today about a week or 2 out from her surgery and is just over the moon. And so this gives us so many more options to be able to truly use regenerative treatment options using her own stem cells, using her own fat, which we injected deep. Because in some of these patients who have bad acne scarring, they have loss of their fat pad. They've lost some of the volume that rounds out that tissue, in addition to the dermis being significantly traumatized. So for her, we injected fat underneath to plump it up, and then I microneedled through the tissue just like you would do to deliver PRP, exosomes, PDGF, any of these products.
Right.
But we used the gold standard, which was nanofat, which is fat that's been emulsified, and literally we tear all the fat apart through forcing it back and forth through sequentially smaller and smaller connectors. So it's the shear stress that rips all these cells apart. And so when we lay it on and then you microneedle with SkinPen, the nanofat literally absorbs right through the skin, right down to the reticular dermis. So we're literally going after these scars both from deep and from superficial. And then she's gonna more likely than not be back, and I told her she may need another treatment in 3 months or so, but we're stacking. Share from your perspective, from the esthetician side, what are some other treatment options that we may need to be combining with her as she's looking through her recovery process?
Well, in the meantime, I took a look at her skin and I realized she had a little bit of melasma as well. And I said immediately she needs to do at least 3 VI peels, and that will also help with the scarring and collagen remodeling.
So this is a multi-modality treatment.
Yeah.
This is not a one
and done.
One maneuver
No.
fixes this.
Yeah.
Because these individuals, they have struggled for a long time with challenging issues at the skin. It's a challenging area to treat. It's the scar tissue that has effectively taken away the sebaceous glands from the skin. And that's really the big aspect of what's been lost. That, some of the nerves, some of the thickness of the dermis, and the sebatium, which is really what really separates facial skin from the rest of the skin on our body, because you have an enormous number, a very, very high number of sebaceous glands in your skin, which is why people get acne, because of all those sebaceous glands in there. So in conclusion, what thoughts or suggestions would you give to somebody who has struggled with acne over the years?
Book a consultation. We'll take pictures, we'll figure out the best option for you and best treatment plan.
And it's probably going to involve
SkinPen.
SkinPen. Thanks so much.